All right, everyone, welcome back to the Performance Matters podcast. I'm your host, Matrixx, and I'm very fortunate today to be joined by Malcolm Sanderson, physiotherapist over at ProActive Health and Rehab, right? Got that all right. Fantastic. Before we kind of dive into Malcolm, I just want to give a quick reminder out there. There are two types of people in this world, Malcolm. There's two types of people out there. There are subscribers and there's non-subscribers. So you might as well join the cool kids. Make sure you follow us on Spotify, Apple, YouTube, whatever your platform of choice is. Make sure you subscribe to us because we want to keep bringing you the weekly rants, raves, and awesome revelations that tend to come out every Friday right here at PMP, right? Also, big shout out to our sponsor, Coachology. Coachology is an AI-powered coaching platform designed to help coaches and athletes collaborate more effectively through video analysis, personalized feedback, and AI coaching assistance. Of course, the goal is to extend the coach's expertise beyond the in-person sessions and provide athletes with ongoing individualized guidance. You can reach them at coachology.ai. That's right. So big shout out to Coachology for this episode. Now, Malcolm, welcome to the show.
Thanks for having me. Appreciate it.
Always a pleasure, man. Just love chopping it up. Okay, so for the viewers who might not know who you are, why don't you just kind of give us a quick background story? Who is Malcolm?
Yeah, totally. I would say first and foremost, father. I got a young, less than 2-year-old daughter, husband, and then I would say very washed up powerlifter turned more endurance person these days, which
Transition.
Never thought I would go this realm. But yeah, that's kind of me in a nutshell. Just a dude who likes to work out in various ways and hang out with my family.
Yeah, it's pretty chill.
Yep.
What was your best squat bench day?
Yeah. So my best was, I was 93 kilo class. I squatted 530. I deadlifted 585 and my best bench was 320.
Yeah. Damn.
Yeah.
Holy smokes. The 90, you said 96 kilo?
93
93 kilo.
Yeah. That was kind of my heaviest weight personally.
Holy smokes, man.
Yeah.
That's awesome. So then how did you kind of get into physio? Like what kind of pushed you into the physiotherapy realm?
Yeah, totally. I was a trainer for a little bit. Like I did some personal training and I liked it. But I always kind of had this weird pull towards like pain and injuries. And it seems kind of just like a nice next progression to, or just different avenue with training because you can combine both.
Yeah.
Right. So it just made sense. So I just jumped in, went for it.
Sweet.
Yep.
So then obviously with your powerlifting background, so how has that experience in training the powerlifting realm kind of shaped your perspective on rehab essentially?
Yeah. It's fun. I like having that as a background because I think a lot of clinicians are very scared to load people, especially like normal people. Like, and when I say normal, I just mean like people who don't really like lift weights or like they do, but it's very like they never go under reps of 10, right? Where I like to try and load people more. So I think that like comfortability with heavy weights makes me very comfortable with loading my patients more.
Yeah.
I think that gives me a bit of a unique realm. And I just love watching people train. It's so fun.
It's a ton of fun.
Yeah.
You kind of knocked on a pretty big point, really. Like, especially, I think it's progressed a long way, but from a lot of experience we've, kind of heard from athletes and just people in general, when they go to physio, it seems like very, I wouldn't say light, but maybe like fluffier, kind of like fragile, you know what I mean? Like very delicate. But in reality, it's like, well, it's still stress is stress, stimulus is stimulus. And if that's what's kind of needed to help move the needle forward, then we have to actually challenge it and have a stimulate that's high enough
Yeah, totally.
to some growth or some adaptation.
Yeah.
So is there anything that you kind of believed about injuries, the rehab process as a lifter that kind of changed once you kind of got into the clinician space?
Oh, that's a good question.
I'm usually good at those. I got to throw some like,
Yeah. Let me think here. I think that just like the big one is like if something hurts, it's inherently bad.
Mm-hmm.
You know what I mean? Like you should stop doing it and take rest. Like just rest. Take 2 weeks off and do nothing, right? Whereas now in the realm, I'm like, don't take time off. Like keep training, but that training might look different, right? Whether, if you're a runner, for example, like you have knee pain, maybe either try pulling back on the pace or like if you need to completely stop running, like jump on a bike, jump on the keep your conditioning going, that sort of stuff. Like keep moving. It just might look slightly different for a short period of time.
Yeah.
That sort of stuff.
Yeah, that's good. That's something I think honestly a lot of people need to hear. I think the default is we call it like CYA. It's like, oh, this hurts. Don't do it. It's called cover your ass. Well, that hurts. Oh yeah, don't do that.
Yeah.
Yeah, just Yeah, taking out. Honestly, we hear that a lot from like doctors
Yeah.
and other practitioners. Like, oh yeah,
Yeah.
no, we'll have athletes or parents come in and say, oh, the doctor said, oh, they can't do anything. They said take 4 weeks off.
Hmm.
I'm like, that's kind of a double-edged sword, don't you think? It's kind of like, yeah, like you feel better,
Hmm.
but at the same time, like you're also creating a fragility around the actual issue. So it's like
Yeah.
it's sensation versus stimulation. Like, yes, it feels better, but it doesn't mean it's, its tolerance has pretty much decreased.
Yeah.
So the next time you try to do something again, it pretty much comes back with a vengeance.
It totally can. Like I've had runners take off a couple weeks of running. They try to run, boom, right away. There's the pain, right? And it's like, okay, not only did you decondition significantly, you got nowhere. Like you unfortunately wasted your time, which sucks,
That's
right?
yeah,
And it's more frustrating.
Yeah, it is. And I feel like it's a perpetual cycle. They just kind of come back and say, well, it hurts again. I got to take more time off. So it's like, at some point we can't just, I think, we can't just keep putting Band-Aids over the bullet hole, like addressing the symptoms all the time. It's like, well, what is maybe the root cause of the issue? Can we not necessarily avoid it, but navigate it in a way where it's like, hey, I think, Steffi Cohen and there's like another rehab that does, I think, a really good job of explaining that, where it's like, there's still things you can do. And like pain is not necessarily like a bad thing. It's just like, hey, is it lingering? Is it throbbing? Is it shooting? None of those things are happening. It's like you're walking a good fine line where it's like, it's uncomfortable, but it's manageable and it's probably not going to make any worse.
Yeah,
You know
for
what I
sure.
mean?
For sure.
So-
Yeah. I implement that a lot. I'll have like with people, depends on the person, right? Because some people push really hard. Some people don't push enough. So it kind of depends on the person, but I'll typically set out like acceptable levels of pain with activity, right? So for example, if it's just, someone who's not a pusher or endurance coper, as we'll call them, I'll be like, okay, you can train, but nothing more than a 2 or 3 out of 10 in the moment that night or by the next morning.
Yeah.
If you have any more than that, it was a little too much. But if it feels within that realm, it's okay. Safe to continue. Good to continue.
Yeah, green light.
Yeah.
Good. No, I think it's something that needs to be reiterated a lot because I think, people maybe think about it, but there's always someone that's telling them otherwise. And I think some people might tend to gravitate towards like, well, this person's saying I can still do something, but it's uncomfortable. This other person's saying, don't do anything. That's easy. Well,
Yeah.
if they said, don't do this, then okay, I will not do that. It's more comfortable. It's easy, but is that really the best thing to do?
For sure.
For sure. It's a very touchy.
It is.
Yeah.
Totally. And it depends. Yeah. It depends on a lot. Who you ask, what their training is, what their perspectives are, excuse me. Yeah. Yeah, for sure.
So do you think, in your experience, where do you think rehab ends and then performance training starts to begin? Or should there even be a clear line?
Yeah. Oh, I think it can be, I don't think it needs to be a clear line by any means. It kind of depends. So say, for example, I have a patient who's working with like someone like you guys, like they'll come and they'll do training under the guidance of someone with that expertise. I'm a little more comfortable letting them go maybe sooner or like touching base much less sooner, knowing they have this person to help guide them. And a lot of the times I'll collaborate with that person too. I'll shoot them an email, that sort of thing. But if it's someone who maybe doesn't have like the knowledge, that guidance, I'll really get them. Like I'll even try to go further than their abilities prior to injury, excuse me.
Yeah.
So it very depends. It's very individual, like everything, right? But it's really fun, like taking people further, than maybe what they could do prior to injury. Yeah. Yeah.
I got you. So then, what do you wish most people, or wish more people would understand about rehab?
Yeah. This is so many things. Rehab.
Start with one.
Yeah. Rehab should really be a better balance between passive and active care. This has probably been chatted on this podcast maybe before with other rehab professionals, but there's a place in rehab for maybe some passive stuff for sure, but it needs to be a balance. And like, you shouldn't just go to your physio and only do hands-on stuff. Like there should be more active care, especially if you are an athlete or an active person. So there needs to be that like getting you moving, getting you into a gym piece. Yeah.
I got you.
Hard stop.
That's good. So then what do you wish more strength coaches understood about rehab?
Ooh. Jeez, you're really giving good questions.
Yo, jab, hook, baby.
I like it. No, I like it. I would just say when it's appropriate to maybe refer to a physio or even like reach out to the physio. Like if you're a strength coach and you're working with an athlete or an individual and you have questions, hit them up. I would be delighted if a strength coach reached out to me and I was like, and they were like, hey, like what can we do? What can I do to make sure this person's hitting all the things they need to hit? that sort of thing.
Yeah.
Like make it collaborative.
Yeah,
You know?
huge. But we need more of that. And I think we're big on that ourselves because it really is like, hey, if you have an injury, acute injury, your physio is like on point on this one. All we're looking for is like, hey, what are some constraints that we can navigate around? It's like, hey, here's some green light things that they should have no problems doing.
Yeah.
Here are some constraints while this is being navigated through. But anything outside of this, green light, leave it to you to go and do what you have to do to fulfill that.
Yeah.
I'm like, fantastic. That is to me perfect collaboration. Like, hey, they're taking helm. They know what the root of the issue is. They're putting the constraints in time. They give us a timeline and say, great, go ahead, green light. And then vice versa, we just communicate back, hey, here's where we're at right here. Here's some plans we're doing. Any feedback? Yeah, these all look good. Or Zoom look good.
Yeah.
I think sometimes people just get kind of caught like an ego thing. You know what I mean? Both sides of the coin.
Yeah, of course.
It's like, they want to, I don't know, pound their gorilla chest and be like, well, I'm in charge. This is like, I said, no, don't do this. Should be, seeing me versus seeing someone else. It's like, well, we're supposed to be doing what's best for the person.
Yeah. And at the end of the day, that's all we want. Right. And yeah, 100%.
It gets a little crazy. You know what I mean? I think there's sometimes too much ego on both sides of the spectrum here when it comes to rehab and then proactive care and then just training in general. It's like,
for sure.
So then again, probably on the flip side, what do you wish more physios understood about performance training? Because you have experience in both. You've done this side, now you're on the other side. So let's flip it. What do you wish more physios understood about the actual performance training side?
Yeah. I think it would be nice for there to be a bit more education in school, in physio school specifically. And it doesn't have to be like, crazy in-depth amount of stuff, because there's a lot you cover in whether it's physio, chiro, whatever rehab school you go to. So it's unrealistic to get like a full, certified strength and conditioning CSCS certification with, what I mean? It's not realistic. But just maybe how to work into some of those realms and be a little more confident doing so.
Yeah.
Because I think a lot of physios aren't. I remember in school for me, a lot of my colleagues were very unfamiliar with like simple things like rep progressions or like difference between plyos and like closed chain exercises, like this sort of stuff that's very basic. But when you understand it, it can help so much with prescribing a training or an exercise plan, right? Yeah. Just a little more basics into that realm, I think would benefit physios so much because it'd make them more confident.
Yeah, I think so. I think it's like you have to know everything on the matter, but it's more just like you know enough where you can have a conversation. Yeah. You can have a seat at the table and understand what, some of the basic points are. And that would hopefully help provide care for your people. Like you can kind of like understand where they're coming from. You can empathize a bit more with where they're coming from, where they're trying to get back to. Yeah. And pretty much what it takes to stay like a robust human being in general, right?
Yeah. Yeah. Because I mean, not having that knowledge and taking on certain patients has real life consequences. ACL patients, prime example, right? Like first few months is very straightforward care, relatively speaking. But as you get further and further out, like it becomes more sport specific, it becomes more intense, it becomes more important to like fine tune training variables. And if you don't have that knowledge, you're probably going to do the patient a bit of a disservice. So you either need to refer to someone who knows it or really dive into that extra knowledge.
Yeah. Go down the rabbit hole.
Yeah, for sure.
Take the red pill, man.
Yeah, absolutely.
So then, how do you decide, again, very broad, how do you decide when someone needs to be protected versus when they simply need to start loading again?
Yes. Yeah, I think there are some good indicators, some that the patient will tell you, whether, it's in regards to I'm having pain at rest, I'm having a lot of pain doing these very basic things. That is probably a more like protective way. But if it's like, I'm only having pain doing this one specific thing, maybe I'm a little more comfortable and like, okay, let's start to work into this. Yeah. There are some other things too, like if you're suspecting a more serious bony injury, like a bone stress injury, a fracture, obviously protect, all that jazz. But I'd say it really just depends on like the clinical reasoning, what you think is going on, where they're at, what they're telling you, and that kind of helps guide your path forward, right?
Yeah.
Yeah.
I got you. So do you think athletes sometimes become afraid of movements because of how we talk about their injury?
Yes, for sure. Yes.
It's
Hard yes.
Hard yes.
Yeah.
Say the mic for the viewers. Say it again, man.
Yeah.
So how do we kind of overcome that?
It's hard.
Yeah.
It's really, really hard. And I remember even when I was in school, I was like, I'm going to come in, I'm going to change people's minds. I'm going to make them, so confident in their back. And I still try to do that. But I realized,
uphill battle.
Yeah, I kind of got slapped in the face with the realization, man, it's hard, and I continue to try my best. But yeah, I think there's multiple levels in which people kind of develop those beliefs about their body. Like societally, there's these kind of messages we hear, individual conversations, that sort of stuff really shapes it. And it's hard to change that.
Yeah. I think we found that a lot of times too, is because we might say a certain thing and be like, hey, I think this is, or they'll have a perspective from a doctor or something else, which again, listen to your doctor. I try to help encourage athletes, ask better questions, right? Because sometimes if you kind of just give the broad picture thing, they kind of put you in a box and you're labeled. And I think that's what they kind of tie themselves to. It's like, well, I had ACL repair. I can't do anything. And I go back this way, like in a box. Like, okay, well, maybe ask other questions like, hey, I can't do these things. When can I start maybe introducing these things? What are the parameters of this thing? Like you're essentially trying to fight versus just like these hard, labels like, okay, you can't do this. You're done with this. Maybe like look for a pathway of some sort, like some sort of timeline, some sort of proactive approach of like, hey, you know what? Yes, we're limited to these things, but there's still a ton you can do. Let's focus on these avenues. Nothing else might keep you mentally sane, because we know athletes get really depressed.
Yeah.
And that stuff happens.
Yeah.
It just spirals. We've seen that a ton of times too, because they're so defeated. They need something to hold on to.
Yeah. Yeah. I think, especially as rehab individuals, we need to make sure we clarify what can you do. I like to start with that when I talk to people, where I have to put some sort of constraint on what they can do. I always try to outline like, this is what you can do. Because a lot of the times if you just say, I don't want you doing this, and you never really talk about what they can do, people don't think about it, right?
They don't.
Or they're like, oh, I wonder if I can do this. I don't know. They didn't say, right? So it's much better to be upfront because I'm sure you guys see it. People, like if you're an athlete and you can't do your thing, it hits you because it's part of your identity. It's part of your life. It's part of what you love. It's not a small thing to take that away from someone temporarily. So having avenues to continue to train, exercise, move, whatever is huge for sure.
It takes a big mental stress off them and it gets them hungry to just look forward to when they can return versus essentially wallow in this pity of I can't do anything. And then it just spirals.
And then it makes it that much harder to get back.
It does.
Yeah,
it does. Like, we have so many examples of kids that just, and again, you feel for them, like you're empathizing with them. You're like, man, especially, like, I'm sure you've been hurt too and had some big injuries. Like you can relate to some degree. Like, I understand what you're feeling, but here's what might help. Like, there's a ton of things you can do.
Yes.
It might not be exactly what you envisioned.
Yeah.
But there's something you can chase, something you can hold on to. And while you're doing those things, you're kind of hitting it from both avenues where this is getting the time to heal, but you're also progressing these things over here. By the time you're done, you'll be in a much better spot than if you didn't.
Yeah, for sure. And I mean, sometimes I'll even take it one step further, especially depending on the person. I'll be like, I want you to do this thing. Like, I need you to do this thing.
Harder.
Yeah. Yeah. Cause then it's like, it has that underline of emphasis, like you should do this.
Yeah.
Right.
I think it hammers home a little, better. Like, okay, guy said do this. I'm doing this.
Yeah.
I can focus on that.
Yeah.
I like it. So we talked about ACLs very briefly. So I think you focus on ACL, I guess, a specialty, right?
I like it. Yeah. Like it's a specific area I like. I enjoy doing it. It's lots of fun.
So what made you want to focus on ACL as like a primary kind of like, what made you interested in ACL reconstruction?
Yeah. Yeah. So I'm 3 years out of, my schooling now. So I'm 3 years into practice. So I've had some time to kind of like feel out what areas do I really like. And I've come to learn I really like lower extremity. Like I really like knee, foot, ankle. And I really like ACL because it's a long one, right? 9 months to a year, sometimes a little bit more than a year. So I like having that long-standing relationship with people and seeing them through all of these phases. I find it very rewarding seeing them go from like walking with crutches to jumping on and off a plyo box, right? It's a huge, huge thing. So not only do I get to see their physical improvements, but also their like confidence grow. And that's so much fun. And I find a lot of the people who get ACL repairs, they're ready to do it,
Yeah.
So I think that area specifically I've been very drawn to just because it's a lot of fun.
Ton of fun.
Yeah.
So then what do you think we're getting wrong still about ACL rehab?
Yeah. Two things.
Two things.
Loading too soon
Okay.
and then not loading enough. So I know it's almost like contradicting, right?
It's
But
contradicting.
hear me out. So early stage, right? The knee's super sensitive. It's probably swollen. You probably can't straighten your leg fully. You may not be able to bend your leg fully. A lot of the time, not a lot of times, but sometimes clinicians will start loading the knee too soon, whether it's like terminal knee extensions with a band, maybe some high box squats, right? And the knee's just not tolerating it well. And then you just have this like chronic swelling. You'll have this maybe pain that's lingering for too long. So that's kind of what I mean by loading too soon.
Yeah.
And then I've seen multiple ACL patients who have come to me. It could be years after their surgery. I had one guy who came to me. He was 5+ years post-op ACL. And I asked, I was like, okay, what'd you guys do? And he was like, we did bodyweight squats. We did some lunges. I saw him for 4 months and that was it. And I was like, okay, yeah, not enough.
Yeah.
And he was still having problems from it. So we started to really, really load it.
Yeah.
So I was having him do like Bulgarians, single leg assisted pistol squats, like stuff like that, because we needed to build that knee tolerance. So it's the double whammy of loading too soon and that, you know what I mean? So
yeah. Fine line. You're doing too much too soon. Oh, you're not doing enough now.
I know. And a lot of it is just where they are within that rehab timeline.
Yeah.
Yeah.
I got you.
Yeah.
Okay. So then let's say, what would you want to see personally before saying an ACL athlete is ready to compete again? Like, what are we kind of looking at to make sure, hey, and typically what we see is like, they follow the timeline and the surgeon might be like, nope, you're good. Go back to whatever you're doing. What do you want to see before you feel comfortable saying, you know what, you can go back to sport and be chaotic?
Yeah, for sure. So time is going to be one thing. Mm-hmm. For me personally, irrespective of how they're doing functionally, I like to wait at least 9 months, but even more research is saying a year, just to be like super safe for return to like full sport. That's different than like return to practice, right? Mm-hmm. So that's one thing. Like time matters here. Unless you're like Neymar and you're like going back soon because you have a team every day work, right? That's not what I'm talking about. That I want to see significant confidence from them. Like when we're doing stuff, whether it's like trying to recreate play or drills, I want to see like no hesitation, full confidence, all that stuff. Because in play, if you hesitate, it can be bad. Yeah, right?
Really bad.
Yeah, that's a big thing. I do some testing for limb symmetry index, specifically for quads typically. Mm-hmm. So that's basically where like I measure your quad strength and I get, how many kilos you're pushing out and I'll compare it to your non-ACL leg or your quote unquote stronger leg. Mm-hmm. And I want to see like at least 95% between the two or above, ideally. That's a huge one. No swelling, full extension, really good power. I'll do like, single leg hop testing. I'll do max jump testing, all of that kind of plyo stuff to make sure that the distance and power between or the distance and power between the legs are as close as possible. Now, naturally, you're probably going to have like a little bit of discrepancy. We all have our like dominant leg, but that's okay. But we want to get as close as possible. And then practice, getting them back into practice in some capacity, that sort of stuff. So all of those things are like a battery of what goes into return to play for me. Yeah.
The confidence thing is a big part.
Huge part.
Big part. I think, because, sport's chaotic, especially team sports. Like they're very chaotic. It's not like it's, like a race where it's point A, point B unobstructed. It's like if you're playing soccer, volleyball, basketball, hockey. It's like you can't predict what your opponent's going to do, how things are going to react. Yeah. It's very chaotic. And you're right. If they're not confident in a closed environment to do some diverse movement, how the hell are we going to expect them to go out there, do diverse movement, but also respond to their environment that's ever changing?
For sure. And I mean, like lack of confidence, nervousness, hesitating when you move changes how you move. And sometimes that can have consequences. Yeah. Right.
Are there times like, how do you kind of help an athlete overcome that confidence? Like, let's say they are like, by your standards, like, hey, they've hit all these physical requirements. Yeah. We should be good to go, but we're lacking in that confidence. Like, what do you kind of walk me through how you hopefully build some of that back up?
Yeah, it's a great question. I haven't had to do this, thankfully, but I'm sure I will get a patient who maybe needs some extra help in that realm because it's a huge part of it, right?
Yeah.
Because I can say I can have them do all the things, but it still might be in the back of their head. And I think that's maybe where like a sports psych referral comes into place. We have one who I work with through our clinic. So maybe even getting into that realm can help just bridge that gap for that confidence piece, right?
Yeah.
Yeah.
Okay. I got you. That's fair. I mean, it's an ever evolving thing. So it's like if an athlete can hopefully overcome those hurdles, then they're in a better spot anyway.
Yeah.
Right.
Yeah.
So now kind of shifting gears a little bit.
Yeah.
But are there injuries or conditions that you think we might still, baby too much or kind of like are taboo now where it's like, you know what, it's kind of, it's not all that bad. I think sometimes you get caught up in some stuff.
Yeah. Yeah. I mean, what comes to mind right away is typically chronic low back pain. I think
That's a good one. Good answer.
I think, yeah, I think, oh, thank you.
Good answer. I like that answer.
I think is one that we tend to maybe be a little too gentle with.
Yeah.
I think that's an area where we, again, could try to better get the person more confident in their abilities in their body through exercise. It doesn't even have to be like resistance training, but just movement, right? Depending on what their preference is. Yeah, I think that one like immediately comes to mind.
Yeah, that's a big, honestly, like 80% of people have back pain
in
their lifetime, at least once.
And it's weird, like you hear it so much like, oh, I stopped doing this because of my back, right? And like you'll hear it like my knee, but like back is like
big one,
right? And you just imagine like what maybe those people's lives could be like if they tried to push through it more with guidance, right, from a rehab professional. And that's not to say everyone would be back at what they wanted to do, but I think maybe things would be different.
Yeah. No, I agree. I think we've a lot of regular folks who came to us with back pain. And I think we're obviously hesitant, like, well, I can't squat. I can't deadlift. It's like, well, let's do some of these things and build up some confidence in other things. And then ironically, they love doing all those things. They love deadlifting for some reason. They love squatting. That's just their thing. And there's no back pain. So it's like, I think it goes back to that weird thing. It's like, well, your back takes stress and takes load just like anything else. It gets sore too. I think sometimes it's helping people distinguish between like pain versus soreness. Like they feel something in the lower back. It's like, is it pain? Like, is that like a muscle soreness? Like when your quads burn or when your hamstrings are tight?
Yeah.
Is your back?
Yeah.
You know what I mean? Like your back has muscle.
Yes.
Is it pain or is it like you think it's back soreness? And then is that now preventing you from, are you just kind of like hesitant now to do something? Because I get it, because I've had back pain too myself and some issues, but it's like I understand how debilitating that can feel when it is pain, and the hesitancy towards trying to return to something. But at the same time, you also realize, well, I have to build back tolerance to it. Yeah. Otherwise, it's not going to get any better. And the minute I try to do something or have it handle something, I'm screwed.
Yeah, truly, right? Yeah, it's a good differentiator. I'll even have patients who come and see me, and I have to ask, like, hey, is it like pain, or are you like, is it discomfort? Right? Because they're two different things.
Big things.
Yeah. So having a qualifier like that matters a ton for sure.
I think people can't just distinguish between pain and discomfort.
It's hard. It's hard. And the more I work, the more I'm like, man, it's tough to describe symptoms because like no one actually knows what you're feeling. We just base it off our own experience. Yeah. It's tough.
Yeah. It's like if the worst thing in your life ever happened was you sprained your thumb, that's a 10 out of 10. But if you've, torn your knee up, sprained thumb's like a 2.
Yeah.
So it's all relative to what are you defining pain on a scale of 1 to 10 is?
Yes.
Sprained thumb or broken knee?
Yeah, for sure. 100%, right? Yeah, our own individual experiences shape all of that, right? Yeah,
It's a crazy one. So then, what do you think now, something that athletes commonly hear about injuries that you wish would disappear?
Yeah, it's a good question. I don't know if I have one thing, but I do wonder if maybe athletes would be more comfortable if we kind of accepted that injuries are a bit of a part of sport in a sense, right? Like injuries suck, and I don't want to diminish anyone's experience because they suck, but like it's kind of a part of it, and you can come back from it, right? It might take some time, might derail some plans, but I think being okay with the possibility may make people feel a little more comfortable, especially when it happens.
Yeah, I think we literally did a presentation last year. We actually do a lot of presentations, but we had same slide. The slide is regarding injuries. It was like, if you don't want your athlete, for the parents, but also the athlete, if you don't want to get injured, don't play sports.
Yeah.
You stay in sports long enough, you're bound to get hurt. It's not a matter of if, it's when and how severe.
Yeah.
right? You're just trying to delay the inevitable.
Yeah.
Delay the inevitable, and when it happens, reduce the severity. That's
It's true.
all it is.
I mean, yeah, I'm sure if you polled every athlete who came in here, you would get probably all of them have had an injury of some kind.
Every single one.
Yeah.
Some, less severe, some, acute, some major, some had surgery,
Yep.
some just kind of going through the chronic, the bumps and bruises that come with the season, but they've all had some sort of issue that withheld them for a timeline.
Yeah.
That derailed some shit.
Yeah.
You know what I mean?
For sure.
It's just a part of sport. I think you're right. I think having athletes accept, like, if you decide to embark on this endeavor and you want to take this seriously and, do the higher level stuff, you accept the risks of this is probably going to be something that happens at some point in your career. Yeah. It's hard to go a whole 10-year career span and never get hurt.
Yeah.
Maybe some have done it, but I've yet to meet one.
For sure. And I mean, it's part of it, but then you think, the flip side of all the joy, fulfillment that sports brings you, right? It's a small thing within that massive, ability to fulfill your life, right?
Yeah, I think I get it, because in the moment it feels like that's the end of everything. It's like, well, this is just a moment in time that this too shall pass, right? How do you want to help this go away sooner?
Yeah.
You know what I mean? Let's be proactive about it and actually do some things that we can control, knowing that we don't have much control or anything else.
I think there's some parallels. I thought about this lately. I had a patient to me say, like, I don't want to have pain in my life. And my initial reaction was like, I don't think that's possible, really. Unfortunately, like, it's kind of part of life. It's an evolutionary thing. It's good. Obviously it can be debilitating and all of those things, when it gets maybe out of control, but yeah, it's not really possible. Like, it's not really possible to never get injured or feel pain in sport, right?
Yeah. It's like saying, don't ever be sad. Don't ever be mad, or it's like, it's just, you're a human, dude.
Yeah.
Like, shit happens.
It's going to happen for sure.
It's going to happen. And it's more about how you respond and what you can control at that point. It's like, things go wrong. What do you want to do about it?
Yeah.
Do you want to sit there, wallow in it and say, it'll never get better? Okay, well, guaranteed, probably won't get better then.
Yeah.
Or do you want to say, hey, I have control of these things. I'm going to navigate it and see what happens on the other side.
Totally.
So then, what do you think of asymmetries? Do you think we overreact to asymmetries? And the reason we ask is because we see a lot of athletes that go to a physio or a doctor or someone, they're saying, oh, this is off balance by this. I'm twisted this way. My hip's high over here, this. So I'm always curious about asymmetries.
Yeah.
Welcome to Iron Performance Center, Niagara's home for real personal and performance training. We're a community obsessed with building durable, explosive, game-ready humans. No gimmicks, no shortcuts, just training that works. From athletes chasing scholarships, to pros chasing championships, to regular people who just want to feel strong, move well, and stay built for real life. If you're willing to work, you're our people. Our system is simple: smart programming, elite coaching, and a culture that pushes you to levels you didn't know you had. With modern technology and principles-based programming, we track your progress, teach you movement skills, and give you every tool you need to perform when it matters most in whatever arena you call home. Iron Performance Center, because performance matters.
So if I have to give I'll start with a general answer. I think we do make a bigger deal out of them. I'll just clarify for the ACL thing, like quad strength asymmetry matters, but generally, no, like, it's fine. You have asymmetries. I mean, you have a dominant arm. That's an asymmetry. It's fine, right? Some of them can maybe get a little disproportional, but I think like the hips being out of alignment or the hip asymmetry, I don't tell people that because I can't test for that accurately. And I just don't really think it matters as much as people maybe think it does.
I think it gets blown out of proportion a little bit much.
Yeah.
I mean, because I remember I always say this: if I were to walk into a chiro's office right now or a doctor's office right now, they'd probably find 10 things wrong with me, but I feel fine.
Yeah.
You know what I mean? It's like, I remember one time, I think I had to go get this was years ago, I had to go get new running shoes. So I said, okay, I'll go to this running shoe place. I don't know anything about it, but they, this whole foot analysis thing. And the lady was like, oh my God, are your feet broken? I was like, no, they're fine. Oh, well, you should see something. Your foot, your arch is so collapsed. It's not good. Your feet are, I'm like, I did wrestling as a sport. We had flat shoes. It was just like, okay, I guess maybe it's bad for that sport, but like, it allowed me to do my sport really, really well. It's like baseball players, same thing. They have lax in their throwing arm, not so much in the other arm. It's like, well, part of those like asymmetries, I think, are like, they make you unique to do the thing that you in sport are trying to do better.
Yeah.
You know what I mean? It's like, that's part of it. And then at the other end of it, it's like, well, if you're like hips too high over here, this is like, it's like, well, You feel fine? Yeah, then who cares?
Yeah. Why change something that's not broken,
Yeah, like,
right?
why are you trying to look for it? Don't trouble. You know
Yeah.
what I mean? Don't blow something up if it's not bothering you yet.
Yeah. Yeah. It's kind of like, why create a problem that doesn't exist, right? And it's interesting to bring up the feet thing, right? Like, yeah, there's, flat feet, bad, right? Is what people say. But even in research nowadays, there's been a bit of a push, like pronation, flat feet. These are normal anatomical variants amongst people that for whatever reason we're pathologizing.
Yeah.
And it's like, maybe they have foot pain for a different reason.
Yeah.
Right.
Maybe it's just like the easiest thing they could see. It's like,
Yeah.
oh, that's got to be the reason. It's like, well, maybe not.
Yeah. There's a ton of people with like the flattest feet ever who have never had foot pain. So why do we make this an issue?
Yeah, I think you're right. I think they're just trying to find, maybe people are just trying to find something to diagnose the issue, or like find something that they can hold on to and say, look, see, foot arch is bad.
Yeah. Yep.
You're broken. So, well, hold on.
Yeah.
Like that's the worst one. Again, athletes will sometimes take it, I don't know what, because it's like the middleman, broken telephone.
Of course.
They'll say, my doctor said this, my physio said this. Like, I don't even know what they actually said. Maybe they misinterpreted it.
Perhaps.
You know what I mean? Maybe the athlete's like, well, they said I can't do this because my foot turns this way. It's like, okay, so then you don't want to play sports again? Oh, you're still going to practice. Okay, then. So what?
Yeah.
You fine? Yep, you're fine. Okay, good.
Yeah.
Go play.
Yeah, totally.
Have fun.
Totally. We don't need to overcomplicate or put up more barriers than there already are to be active, right?
I agree.
Yeah.
I agree. Do you think the rehab industry sometimes makes people feel more fragile than they typically are?
Yep, for sure.
Yeah.
Yeah. I think, again, this even kind of circles back to like we need to load more people as physios, right?
Yeah.
Or like we need to, people with, back pain, we need to get them moving as opposed to like protect, 100%. Sometimes we're our worst enemy, rehab professionals, unfortunately. I think there is a change that's slowly happening as more younger grads come into play. But yes, I think historically for sure.
Yeah.
Unfortunately.
It's all right. I think it's all moving. I think every industry has that.
Yep.
Everyone has like a label, that a preconceived notion that we're trying to overcome. You know what I mean?
Yeah.
Like it happens everywhere.
Yeah.
So it's nice that at least growing in the right direction.
Yeah. And I mean, it's tough too, because you see it on socials, like social media, the like TikTok where it's like an X across this movement and like,
oh, those are the worst.
Yeah. It's just
those
like
are the worst. Like, hold on.
It's like just the lowest tier content ever. And it's inherently wrong and can be harmful for people.
Yeah. There's no context. Like this exercise is bad. Don't do this. Do this instead. Like,
yeah. Green check mark. I know. Yeah.
It's clickbait.
Yeah. Yeah. Very clickbaity. For sure. Not great. Not great.
Awful.
Don't listen to those people.
Please don't. Yeah. Please don't. So then I'll say this. Is there a rehab exercise you think gets way more credit than it deserves? Just a left park one.
Yeah. Okay. I'm trying to think. Okay. Hot take.
I love hot takes.
Hot take.
Hit me with it, Malcolm.
And this is just my personal philosophy. I think the McGill big three get a little bit more than what they probably deserve. And it's nothing against those three exercises, but for me, my perspective, I'm sure you guys feel similar as, movement experts and coaches and all that stuff. Like moving in general is very good. There is not one specific exercise that's superior to another, especially in the rehab context per se. The McGill big three, whenever someone has back pain, it's like McGill big three, boom, 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 do these, you'll be fine. They're fine exercises, but there's also so many other things you can do for back pain. Walking, yoga, running, cycling, all of these things have been proven to help back pain. It's just not like a method, quote unquote.
Yeah. It's not sexy.
Yeah. And like do McGill big three if it makes you feel good. That's fine. I have zero beef. But it's not the only way.
Yeah. They put a lot of weight into those big three.
I
remember like, the Back Mechanic book came out.
Yeah.
Stu McGill at Waterloo, I think he's retired now, but he, we had that whole thing because he did the whole powerlifting rehab when the guy broke his back. And they also did that and he came with that method. But I think people put a lot of weight into it, which is, it's good. If it works, great. But at the same time, it's just one avenue that you can maybe explore. And then I like reading, I can't remember who it is at Rehab U, but she does a good job. And then so does Stephanie Cohen because powerlifting backgrounds as well. I love seeing their rehab stuff, introducing a lot of like loaded carries, purposeful walks, stuff like that's like, hey, like they're doing stuff pretty much in week one of these, this protocol. And it's like, just shows like, hey, it's not just your basic, modified sit up.
Yeah. All that jazz.
Whatever.
Yeah.
And that drives me insane. I remember nothing drives me insane more than rehab is me just throwing more reps of the same shit.
Yeah.
Over and over again.
Yeah.
I remember one person was like, oh yeah, okay, we did 10 dead bugs. What's the progression? 15, then 20. I'm like, At some point.
We can progress
At
this.
some point. But they think progression is just adding the
Yeah,
same.
yeah.
So my analogy is like, okay, if I told you bicep curl a pencil 100 times, and I said, okay, bicep curl a pencil 200 times, you gonna feel any different?
Probably not.
But,
Yeah.
no,
Yeah.
it's like
Just a
some
lot of
point,
time.
yeah, we have to increase either the distal challenge or the proximal stability. They have to be challenged with load. It's like, hey,
Yep.
you go from a more stable position to a less stable position with load. That's the whole point. It's like you can progress, dead bug to, okay, maybe like a bird dog row or like a single arm freestanding
Yep,
row or
for sure.
something.
Yeah.
Like it's not just adding more of the same remedial shit. At
Yeah.
some point, we have to progress the level of stability as well as the load in that position to actually build tolerance.
For sure.
Not just bicep curl the damn pencil 1,000 times.
Yeah. 100%. Yeah.
Even it's like HB2.
Yeah.
So do a Sharpie or something.
For sure. Yeah. Progression, super important, right? Rehab parallels training like that. Things need to be progressed. Loads need to be increased. All that stuff. Super important for sure. I get that beef on your end because you're like, come on, let me just put a dumbbell in your hands. Yeah.
You know what I mean?
Yeah.
Stop telling me just to do dead bugs or bird dogs or,
Yeah.
it just drives me insane.
Yeah.
And, they get the rehab paper. It's just like this generalized shit. I'm just like, oh my God, man. I'm like, they're doing like a split squat 5 seconds ago, like rear foot elevated with like a heavy dumbbell. And I have to go back and now their rehab is, I got to go do dead bugs now?
Yeah.
It's like, you've got to be kidding.
Yeah. It's back to the loading. It's maybe underloading them, right? We need to make sure it's appropriate and at the point it needs to be.
Can you imagine like trying to like warm up for like a heavy deadlift and your warm up is like, okay, we're gonna do like 3 sets of 20 dead bugs.
Nope.
How is that?
I don't got time for that.
No. What are we doing?
Yeah.
It's like, what are you doing? It's like, we got to do something.
Yeah.
Get ready for like, I always find it funny too, because athletes this drives me crazy too. There's another, a hot take. This is
let's hear it. Let's hear it.
This is me getting pissed.
I like it.
It's when athletes will, for example, let's say they hurt their back, hurt their knee, something. They will go to rehab.
Mm-hmm.
And then it's like, let's say they're doing 25% of their capacity. And then they'll go to practice or a game and do 100%. And then think coming back down to 25% is fine. And you're just like, listen, it's like cooking a damn chicken. You can't overcook the chicken and then dial it back. You overcook the chicken, you toss it out. You're better off undercooking the chicken. Oh, it's undercooked. You put it back on the grill and just gradually heat it up again. You can't go from 25 to 100 and come back down and think you're going to solve all your damn problems. That drives me insane.
Yeah.
You're like, all right, my knee hurts at practice, but I'm going to go do it. I'll do like 3 sets of 20 banded TKAs. Okay, I'm going back out there. It's like,
yeah. There's clearly a disconnect between their rehab and where they're at in sport for sure. Yeah.
It's like I know it's never going to be perfect, but it's like there's got to be some form of like systematic progression.
Yeah.
It's like, can we gradually increase the tolerance, not just cross the line and think we can come back down to 25%? This will fix it.
Yeah. And that's where us as providers need to do better, right?
Yeah.
Like I know providers are busy, but like we need to make sure we're showing up for those people for sure.
Yeah. Honestly, I think it's, if you find good rehab specialists, that I would agree 100%. I think 2 things. I think 1, strength coaches need to know more about the rehabilitative issue, like the rehabilitative side of things.
Mm-hmm.
That way, again, same reason, might not know everything, but you can have a conversation.
Totally.
Speaking the same language with the practitioner, you're in the room. I think on the other side, like you said, I think practitioners need to know more about the training aspect. Say, look, it's like these things should be a seamless blend, not just this is us, this is them. It's like, yes, this is my scope, but I can also help progress them through so they're ready to be, this person takes point, they give the guidance, but these people take point. They can speak the same language and progress in a way that makes a good impact and not bubble wrap somebody and then send them off and think that's the magic pill.
Yeah.
Or vice versa.
Yeah.
Strength coaches are like ignorant. They're like, no, you're fine. All of a sudden, next thing you know, we have other issues and they get sent back the other way.
Yeah.
It's like, guys, it's really not, to me, it's simple. It's like, hey, you know your thing, we know our thing. We'll be able to speak the same language and be open to hearing a different point of view.
Totally.
And work together to get the damn thing done.
Yeah.
You know what I mean? Like, it just drives me insane. The disconnects. It's just frustrating.
I know. Imagine like how much good could be done for people and athletes, right? If there was just more of collaboration between providers and trainers and whatnot, it'd be amazing. Same with like even up to surgeons, same thing. I think there's a lot of disconnect, unfortunately.
Yeah. Do you guys, aside from like strength coach, do you find you have disconnects more with like MDs and everything else, people who are coming? Because I guess like they have, let's say, have an ACL person, surgeon gives a recommendation. Either on ACLs, you probably see a lot of referrals from, different surgeons. Do you see like something that's different? You're like, I don't agree with maybe that surgeon's recommendation, but you're also maybe confined by, he is the guy that put it back together.
Yeah. Sometimes like a patient will tell me something, because that's how I hear. Like, say a patient goes for a surgical check-in, post-op, whatever. I'll be like, how'd it go? And they'll tell me. So it could be broken telephone, again, to go back to that, right? But sometimes I'll hear things where I'm like, interesting. I don't really know how to maybe approach that, or like, I'm not really sure I get that. And I do wish that I could just like call the surgeon up, be like, hey, do you mind clarifying so that I am fully on this, like, or fully understand this? But unfortunately, that's not really how our healthcare system works, because like surgeons got no time for me. Sometimes I'll write a note and be like, bring this to the surgeon so they can see like where I'm at, what I'm thinking, what we're doing. But I do wish across like all parts of our healthcare, it could be way more collaborative, right? That'd be amazing. But unfortunately, that's not how it is. So yeah, sometimes it's like, what?
Yeah.
But
I guess the judgment, like, what do you default after? What's your default? You just kind of do what they,
typically, yeah. But like usually I've never run into anything where it like completely derails my plan. It's more like another consideration that I have to build in. That sort of thing. But it's never like okay, we need to completely change what we're doing here. Yeah.
I got you.
Yeah.
So then what do you think are overrated exercises? If you had to like, kiss, marry, kill, like what are like some overrated exercises you're trying to like say, scrap it?
Okay. Genuinely, none. But I will give you like ones that I don't love. I know. I know. I'm very pro movement of all kinds, because I just think it's important. But things I personally don't prescribe, because I feel like I would rather try and do other things, would be like TA activation, right? Like a transverse abdominis activation, stuff like that.
What is activation?
Just like an isometric contraction, really. Yeah. It's an isometric. I don't even know why we call it activation. It's isometric.
Like, I don't understand. Half people say like, brace your glutes, or like, flex your core, or like, I don't even know, like, activate your glutes. I'm like, okay, what are we doing?
Maybe it just sounds, I don't know, maybe it sounds fancier.
It sounds fancy. Like, your glutes weren't activated, you fall on the ground. Like, I would be on the floor. Yeah,
I personally don't use the word activation at all in practice, because I feel like the undertones of that means, like things can be deactivated, which just is physiologically not possible unless you have like your nerves are cut, or you have a spinal cord injury or something. But I don't do TA activations. I'm not a huge chin tuck person. I've maybe have given them twice to people. Things like that. I would rather people get more bang for their buck, do bigger movements so that they can have more positive adaptations or benefits from them. Classic one that gets hated on is clamshells. I don't really use it very much.
Yeah.
Maybe like once I have. But I like to like get people like, I'm a big box squat guy, because it's a great intro to squatting, especially for people with knee pain or back pain, because you can modify the height of the box, right? It's a perfect introduction to get them squatting.
Box squat or squat to box?
I guess squat to box, technically. Wait, what's the difference?
Box squat is where you have like the vertical shins with more hip. So they're actually like reaching back, the shins 90 degrees.
No, not that then. No. Yeah. Interesting. Okay. I've never heard the difference. It makes sense.
The only reason, because I got my ass chewed out.
Really?
When I was box squats, I was like, actually, like the classic, what's that from Miss Frizzle? What the hell is that one kid? Actually.
Oh, yeah. My wife would know it. I don't even know.
Oh my God. Well, actually, I was like, oh my God. Anyway, but yeah, so like, I got chewed out for that. It was like
really
squatting is where you have the powerlifting, like 90 degree shins, like west side. And you have squat to box, where it's like you have me traveling, where it's really just like a target is the box.
Gotcha.
Like a whole different thing.
I'm still gonna call it box squats.
Yeah, I do that. Please. Like actually.
Yeah. But that's like a great one. I love to introduce people to. I like getting people to hinge, even if it's unloaded, right?
You teach the hinge, right?
Yeah, I've kind of like found ways to cue people really simply, but some people do have a hard time for sure. It's probably one of the harder ones to like.
Of all the patterns we
dial in,
teach, like we always find hinging. Everyone struggles with the hinge first.
Yeah,
we've tried different variations. Let's start with a goblet. Good morning. Like try that. You know what I mean? On the wall, put like a pole on your back. Try those different things.
Yeah,
it's funny because they'll get the back position right, but then they use too much knee bend.
Yeah,
or they'll have no knee bend, which is great, and all of a sudden their back doesn't work. You're just like, and then it's no, go back the other way. Also, they go back the other way, like, No. You're like, okay, let's just start fresh.
Yeah.
We'll
Yeah.
start
I know.
fresh. Like, give me pieces together.
It's true. It's either like a weird squatty hinge or a stiff-legged RDL, basically.
Yeah, it's never one. It's always one of those two.
Yeah. But I mean, it's a great one to get people doing.
Yeah.
Right.
I think box squatting, we love that one. I'll say squat to box. We love having people start with a target.
Yeah.
It makes them feel more comfortable. They know where their limitations are. They don't, especially if they don't know what range looks like, or they don't know what like depth feels like. It's
Totally.
Like, hey, here's a target. You just take away like 2 inches at a time.
Yes. Yeah. It's a great one.
Some confidence.
Yeah. What do you find like, so throwing it at you, what exercises do you maybe find overrated, or things where you're like, you get them from maybe a PT and you're like, oh man.
Oh, I think, well, I hate dumbbell tricep kickbacks because from a physics standpoint, it makes no goddamn sense. It's like you're trying to control, for those who don't know, you're like sitting on a bench, right? So like your elbow or like your feet, your humerus is parallel to the floor, and then you're extending your elbow behind you. Okay. It's like, okay, the fibers are running literally parallel with the floor, but the load is running perpendicular. So you're like, this makes no sense. Cables, fine. Why? Because the force is being applied in the exact same plane. Dumbbell tricep, like, yeah, I'm like, what are we doing?
That's fair.
You know
I get that. Yeah.
Or it's like the lunge to curl. I'm just like, it's not heavy enough to lunge.
Yeah.
You're just curling, but then you're doing multiple reps. So it's like, it's obviously not heavy enough to challenge. So that's one of them.
Yeah.
And then I'm having a hard time with Nordics.
Interesting.
Okay.
Nordics. Yeah. They got a lot of buzz.
Yes. And the reason being is I think there's a better way. I think you're better off with an RDL. A heavier RDL, you're better at it, because most people can only control like 10 to 15 degrees before the eccentric. And even then, it's not really a true eccentric because there's no control on the down part.
That's true.
It's really just a free fall. So you're getting 10 degrees of work and then free falling and saying, now you can use band assist and everything else like that. But even then, you're setting something up where it's like, you're probably better off with an RDL, right? I get it. You're not targeting the knee insertion point of the hamstring, but still, it's still working. Sprinting or cable hamstring curls are great. Fantastic. You can control 2 up, 1 down on those.
Mm-hmm.
If you're going to do a Nordic variation, use a bench. What I mean by that is essentially we'll have our Nordic set up where they're on like a, adjustable bench. And all they do is just drop the degrees down. So they go down, lower it, pull themselves up.
Gotcha.
And just keep lowering the incline down. And then when they can't control it, go back up a notch. And that's their Nordic range. But again, that's still a minimal range. So it's like, if I had to challenge the full extent of the hamstring from the knee flexion perspective, do a cable, right? A machine if you have it, or simply use like a glute bridge roller, attach it to a band, attach it to a cable, roll it in, or stick with RDLs, sprinting. And those other variations are great. I think Nordics are just butchered, personally.
I get it. I tend not to prescribe them much just because like they're hard for most people. And to be honest, I feel like it's easier to just be like, okay, I'd rather you do like, hamstring curls, but like really slow the eccentric down, like take it super slow, right? If I really want to focus on that. So I get that for sure.
Yeah. Or even another one, hip thrusts. Sometimes I don't completely hate them, but I think for the most part, it's such a small range of motion for extension.
Yeah.
It's like, again, just do a fucking RDL.
True. I get that. Yeah.
You know what I mean? Just do an RDL. Plus you're sitting there loading the bar up until you can max out, I get it.
Yeah.
At that point, you're better off doing I know we're coming isometric, but literally just put a pin against the bar and try to contract as hard as you can. Long lever. I like longer lever.
Yeah.
Or say like kickstand hip thrusts. Yep. It's like, okay, now you actually feel the hamstring because the glute's very powerful.
Yeah. Yeah.
You're trying to target the glute, do the RDL, right? Do squat variations. Hip thrust, yes, you feel it. But again, you're also limited to how much load can your pelvis support. So you're better off going single leg, if anything. But even then, it's a very small range of motion. But how much are you actually stretching it, right? By comparison, I get it. It's still enough. But the grand scheme of things, I would probably go first.
I get that.
Tricep kickbacks number 1.
That's fair. Yeah. I never really liked this is totally personal. I never did really like tricep kickbacks. I'd always do like push downs overhead.
Yeah. Anything.
Stuff like that. I just felt like it was way better.
Different degrees of shoulder flexion extension.
Yeah.
You know what I mean? Like I love dips, but a lot of people don't feel comfortable in dips. Do a decline.
I do love some dips, especially weighted dips. Oh yeah.
Yeah. A huge thing. And it's ironically, it's big for our overhead athletes. And that's
I got it.
Right. So it's like, hey, we will typically go like, hey, do a dumbbell decline press. You get some degree of shoulder extension, right? And if you're comfortable, build your way up to a dip, right? Pull-ups, jumps, all those things. He hangs. I love those crawls. So like I would take any of those patterns over remedial shoulder care. It's like, that is shoulder care.
Yeah, for sure.
Hang, crawl.
Yeah.
Like switch your grips doing those things. Pull-ups are incredible. If you can do pull-ups, incredible. Keep those.
Yeah.
right? But it's like, you're doing remedial stuff. It's like, I get it to an extent, but at the same time, hang from one arm, hang with a different grip, switch your grips while hanging, crawl different ways.
Yeah, for sure. Yeah.
Literally, we call it like playground performance. That's what we call it. We'll have
That's a good way to put it.
Yeah, we'll have our kids doing, all this shit was fun when you're 5 or 6. Like, do a bear crawl, do a crab crawl, do like a somersault, tuck roll, do like a whatever, shuffle. We'll do all those things from these awkward positions and it's gamifying it. But at the same time, they're also putting themselves in various positions. Their shoulder has to support themselves. They've learned how to roll.
Yep.
That to me is way better than any remedial shit I'll throw at them.
Yeah.
It's like, they're not even thinking about it. They're exploring, try hanging. Okay, that's easy. Hang from one arm. How easy is it? Oh, it's hard. Okay, great. Hang from there or switch your grips.
Yeah.
You're taking care of your shoulder at the same time. You're building tolerance.
Hanging is not easy.
No, it's not easy.
For anyone who's actually done it, yeah. Yeah, for sure.
You do the banded. Yeah. And it's like, okay, well, at some point, let's get on up there. But
yeah, for sure. For sure, yeah.
Like, yeah, that's my TED talk on exercise selection. I think, anyone I see doing tries to kickbacks, they'll never see it in here. But, anything else, I'll be like, I'm always kept, I'm like, is there a better way?
Yeah.
You know what I mean?
Yeah. And that's where, like, again, movement professionals, trainers, coaches like yourself, invaluable.
It's fun too. Plus, they just have to enjoy doing this shit.
Yeah. It's a huge part.
It's a huge part. I mean, you want to build a confidence. Well, do they actually enjoy it? I get it. It's literally like, people love massage. They love all the feel good stuff. So, when they get like hands-on work or custom work, feels great. It's doing something good, but it feels good. This shit don't feel good. Like, this is the opposite of feel good.
Yeah.
You know what I mean? It's like, I like to differentiate. It's like, look, know the difference between strain and pain, right? Strain, good. Pain, bad. Strain is good, but you have to know what strain feels like. Essentially, strain is a skill. Like, I would argue that straining is a skill. Learning it, what actually hitting like a 2 or 1 RIR in the tank is looking like. Do you know what 1 rep in the tank feels like?
Yeah.
I mean, like, knowing what that feels like is like, and the funny thing is, so we have like a lot of sports science stuff. We have bar speed measurements and everything else like that.
Oh, nice. Okay, good. Yeah, that's sweet.
So we will, like, for example, and my experienced athletes know this. And what we try to do is we try to teach them, like, we're doing like 4 sets of 3 on squat. That's an example. I'll have a velocity cutoff of 0.40 to 0.48 meters per second. And that correlates to how many reps are in reserve, right?
Yeah.
And so the last time, once we're done, there's 3. I'm like, if I had to push you, how many reps do you think you could have got? Maybe 1 or 2. Okay, I'll look at their bar speed. If it's correlating to the reps in reserve, okay, great. And I'll say, yeah, look, this is exactly the range I want us to be in. Speed is correlating with how you felt. So how you felt intrinsically is lining up with the outputs we're seeing, right? Then you see some people that have, like, a fast bar speed. Like, oh, that's right, yeah, same thing. Oh, maybe 1 or 2, but they probably got 4 or 5 or 6. You're like, well, actually, what we're seeing shows us that you probably have more in you. So we have to start to, realize that and try.
Yeah.
Because now, if we get close to the mark of the sensation, right, the exertion versus like the output, the effort and the exertion, it's like, okay, great. Now we are more in tune with what straining is.
Yeah.
So we can kind of quantify it. Right. That's different for every athlete, but for most, I would say high school age athletes are up. It's a great training tool.
Huge training tool. I coached for powerlifting for a number of years, and same thing. Trying to teach someone. I was using RP, but same thing as RI. But it's hard. It takes time to develop it, right? Because I remember I get sent videos and be like, "This is like 3% at an RP 8 or RIR 2, right? Yeah. And I'm like, no, that was like a 6. You could do like 4 more for sure, at least.
It's hard to like teach that.
Yeah.
You know what I mean?
Yeah.
Powerlifting is like, how do you go into uncharted waters? You know what I mean? Like, hey, we're going to do something I've never done before. Let's find out.
Yeah.
You know what I mean?
Yeah. But it is such a good skill for all types of training, great skill to have, especially for young athletes that you guys work with.
I think it's a massive skill. And it's the earlier they learn that correlation, there's exertion, there's effort. It's like, we can quantify it, assuming technique is good, right? That's a skill too.
Yeah.
Assuming technique is good. Then we can find out, like, okay, what is your threshold? Right? It doesn't have to be 1 RMs or that shit. I will have, like, my athletes they did like reps of 5 today. 5 at a cutoff of 0.45. So essentially it's like the same rep in reserve. It's just by your 5th rep, I put on the sheet, by your 5th rep, I want your last rep to be faster than 0.40, 0.45 meters per second. Right? And then I will ask the same question. How many reps do you feel you got? Right? So, hey, you did 5 reps with 2 RIR. It correlates to 0.4 or 0.48. Did that speed by your last rep move in that range? Great. Then you're on point. right? If you felt you only got one more, but the bar speed's telling me something different, it's like, well, actually your fifth rep was like 0.5. You probably could have went up 5 kilos, right? But you're telling me you only got 1 or 2 in the tank. I'm not seeing the correlation with bar speed. So actually, hey, maybe you felt that way, but your performance is saying otherwise. You actually have more from what we're seeing.
Yeah.
Do you feel that?
Yeah.
And then we'll try to go down that rabbit hole and say, let's try it again and see. And it's now we're back in the range. Like that's what a 1 or 2 feels like.
Yeah.
And it could be for any rep range, obviously, right? But,
Yeah. Yeah.
You know, not have to push heavy ones, but you could just have a simple subjective gauge and line it up with something quantifiable. And hopefully they piece together what exertion feels like and the effort that's actually coming out of it. And that way it's tied closer to that way we'll know. And then there's the beautiful part is when you have my experienced athletes, like big shout out to him, Rowan Top, Casserole with Charlotte. Best part is you don't even have to say anything. They will tell you like that moved at this speed, right? Or that felt like I had this. And you look at it, you're like, yep, you nailed it. Like you don't need me to tell you, you know exactly what it felt like. You're that in tune with the movement.
Yeah.
You can feel it.
Yeah.
You know when it was good. You know when it felt slow. That's how in tune you're like, man, that's good stuff. Because if you can control that, you can have that kind of level of control.
Yeah. That's a whole other side of becoming a great athlete, right? Like knowing how to move, but then knowing that body awareness stuff is awesome. Yeah. That's cool. You guys have the velocity tracker and all that jazz.
Oh, it's way, force plates and everything else like that too. It's a blast. But I'll say, I always try to finish with some like rapid fire questions too. I'm always trying to find some good rapid fire questions. Let me see. What do you think is underutilized in the rehab setting?
It's funny, actually. I would say probably that kind of tech. Honestly, like a tin deck, force plates. I think a lot of it is because of cost. I'm sure they ain't cheap. But that stuff.
I'll give a pitch after now. Some cool shit coming out. You guys can take advantage of.
Sweet. Yeah. I think that stuff really helps. Again, like to jump back to ACL stuff, like those types of tools are really valuable because then you get hard data comparing limb to limb, whatever, right? You don't see that stuff at many clinics around here, right? Because of cost.
It's crazy because the force plates were essentially built for rehab first.
It's true.
Right? Like it came into performance after, but like it really was meant for asymmetry. The reason they had like bulb, for example, they built the plates to show asymmetry and standing in balance.
Yeah.
And then they started adding all the performance metrics.
They're like, oh, we could do this. Why not?
They added those in there. People was like, oh, I'll do those jumps. Also, they started jumping, now you do the performance route.
Yeah.
So it's like it literally was built for.
Yeah. It's something I would love to have for a clinic one day. For right now, I have some other small stuff, but yeah, I think that stuff's awesome.
Yeah, it's crazy. I think the cost is huge.
Huge.
But shout out OBR. Though we haven't sponsored us yet, but OBR, they came out with a force plate. That's like a one-time payment. You don't have to do subscriptions for 3-year contracts. It's like a one-time payment.
Nice.
These force plates. That's telling you pretty much the same thing as the bigger companies, which is kind of cool. So
nice.
It's all same shit. So it's like, they're definitely making it more affordable now for practitioners to actually get that sciencey tech that can tell them some meaningful shit at a one-time price point.
Totally.
It's very reasonable.
Noted.
Yeah, we started transitioning to them like for our stuff because like actually have some good stuff coming out. Easy to use. I'm like, oh, perfect. It shows the numbers right on there, so you don't really need an app.
Nice. That's handy.
Have an app, you can, but you don't have to.
Yeah.
So our sprint gates, kids can see the number right away. They don't have to like put the app in. But PBT boxes show the thing on there. Jump bars show the number.
Nice.
Force plates now show the numbers on there.
Nice.
Like, there
yeah.
You go.
Yeah.
Right? Tell some useful data.
Yep. That's sweet.
All right. You a coffee or tea guy?
I'm a coffee guy.
Wow.
Yes.
Good answer.
Yes.
Good answer.
It's the only way.
Yeah, 100%. I totally agree. What do you think is an underrated TV show no one's watching?
Oh, geez. Okay. No, I'm not a Love Island guy, to be honest. I respect it. I don't got 5 nights a week. That's a lot. I got a kid.
I know. I'm bad. I didn't want to watch it. The funny part is like if she's listening to this, she'll be like, "You want to watch it too?" I'm like,
"It's okay. No shame. No shame. No shame."
I got invested. I'm not gonna lie because now it's like just something like, oh, whatever night you're like, oh, we have to watch Love Island. I'm like, okay, yeah. But at the same time, I was like, oh, good, we have something to watch. But I'm not happy about it.
Yeah,
I
get that.
Came to this.
I get that.
What I mean?
Yeah.
What's your go-to? What's an underrated TV show?
I don't know if it's underrated, but like we really like The Pit. Did you watch The Pit? I'm not a medical show guy at all. Like I don't really like Grey's. I don't like Grey's Anatomy. I don't care for The Resident. But my wife was watching The Pit, and I was like, "Oh, you watch it. I don't care. I'm going to do other stuff." And then I kind of watched a little bit, and I was like, "Oh, this is good." And then we had to go back and rewatch everything, and it was super good. So would recommend. Yeah. It's cool.
Piggy Blinders is like my go-to.
Yeah, Tommy Shelby's crazy. Did you like the movie?
I was yes, but also I liked it for the reason that I love the music in it. So I think the music was spot on. I'm mad that that's how I think it was rushed.
Yeah, I
I
get
think
that. I
that
get
that should have been a season.
I get that.
And they kind of had to cram everything and and obviously like the actor not playing Arthur, they just had to kill him off.
Yeah, that was tough because he was amazing.
Yeah. So it's like I think they just try to do too much to kind of wrap everything up.
Yeah.
If I had to, like I love the fact that we all knew Tommy had to go.
He had to go for sure.
It was a guy that wanted death,
Yeah.
didn't come.
Yeah.
So he wanted it. I think it should have seen it. But if I had to, I would have said, don't do the movie. End it the way it ended. Him riding off in the same way style.
Yeah.
Let it go.
Fair.
Let it be up to the audience to determine what happens.
Yeah.
Right? Don't bring it back to wrap it up so abruptly the way it did.
That makes
I think
sense.
the music was good.
Yeah.
It was poetic at the end that way.
Mm.
That Ada scene killed me.
Oh,
I saw that scene. I was like, and it was like, that was blunt.
yeah. I think I was actually like mad. And I don't get mad at TV, but I was like, bro, Ava?
At the theater, I started crying. I was like, this is crazy. I'm like, no, not her. Like, that was the good one. You're like, oh, and you're like, now you definitely know Tommy's gone.
Yeah.
Yeah. That was the last piece of good in his life.
Yeah.
Like, well, that's it.
Yeah.
Game over.
Yeah.
So,
gotta love Peaky. So good.
It was so good. I think it was a little rush.
That's fair. I do get that for sure.
Yeah. It was a tough go. But
yeah.
Anyway, so then I want to wrap up with this. What's next for Malcolm? Like, what's something you're looking forward to?
Yeah. Good question. I don't really have anything major on the books right now, which is kind of all right. I'm just like down. I just want to, keep working, keep trying to do the best I can for the people I'm fortunate enough to get to work with. I'm going to keep riding because that's kind of what I do these days. And be the best dad I can be.
Yeah, that's some good wholesome shit.
Yeah, man. My daughter's awesome. She's crazy, but she's awesome.
Oh, she?
She's like 21 months. She's full of energy, redhead.
How much sleep do you get?
She sleeps great. She's actually been a great sleeper. Yeah, thank goodness.
That's good.
Yeah.
Cool. If you want to learn more about you or get in touch, where can they find you?
Yeah, I'm actually like a social media hermit. I'm going to be honest. I'm not on any socials these days. I've just Yeah, I just hear things from my wife, which is wonderful. She's great. But yeah, if you want to like questions, my email's physiomalcolm@gmail.com. I work at ProActive Center in St. Catharines. If you want to come, hang out, get checked out, whatever, work together. Yeah. That's it. Thanks for having me, man.
Dope. This was great. Guys, this is the Performance Matters Podcast. Big thank you to Malcolm for coming on. Again, make sure you like, subscribe, follow on Apple, on Spotify, on YouTube, because we want you to be a cool kid and be a subscriber, because that's what we do. Weekly Race Relations right here on Performance Matters Podcast. So everyone, thank you for tuning in. Till next time.